Demonstrators on Thursday rallied outside the offices of the Public Health Department in Boston to protest regulations the department has placed on medical marijuana caregivers. The new guidelines prohibit growers from providing cannabis to more than one designated patient, a move opponents say will create a monopoly that benefits medical marijuana dispensaries.
They want only dispensaries to be able to procure your medicine. Now that dispensary could be 100 miles away. If you don't have ability to get there, how would you get your medicine? Well, that's what they're trying to do with our medical marijuana law, and we're not going to take it. Can I hail everybody? Are we going to take it? Say no!
Hell no!
We're not going to take it!
Hell no!
Bring back the grow and bring back the caregivers!
Activist Catherine Rifkin says the DPH regulators are being obstructionist.
We're protesting the unworkable regulations that the Department of Public Health has been putting on the the use of our medicinal herb. It's like roadblocks, they're throwing roadblocks in the way, and that's really not the intent of the voter.
Michael Malta, who goes by the title The King of Pot, says West Coast business interests are influencing state policy to benefit the dispensaries over the needs of patients.
Now we've got people coming in from the West Coast that are going to all these different states, including New Hampshire, and they're taking the grow and the caregivers out of the marijuana laws. And that's how they're getting them passed. That's why your governor 2 weeks ago in New Hampshire just passed the marijuana law, because there's no growing. There's a certain entity of people coming in here from the West Coast, and they know what they're doing.
Do you mean professional growers?
Professional businessmen. People that don't even, they're only caring about the dollars. They don't care about the patients. They only care about the dollars. That's why they want to have them in a monopoly. The Department of Health right here with their regulations wants to have a monopoly on dispensaries in Boston, Massachusetts.
Valerio Romano, a lawyer who works with dispensaries, defended the DPH, saying the regulations are meant to keep the drug from being used for non-medical purposes.
I'm really impressed. I think the Department of Public Health did a fantastic job. They thought this thing through as thoroughly as possible. They looked at what's happening in other states, and took the goods and the bads and fixed what they could. And I'm really impressed. I think they did a really great, thoughtful job. The DPH is trying to make sure that medicine is only going to patients, and the industry here in Mass and the medical marijuana program isn't polluted with a lot of diversion for non-medical purposes.
For the State House News Service, I'm Mike Deehan.